Prestige Technology. Confronting Alabama's Healthcare and Broadband Double Dead Zones. Introduction. Healthcare is no longer determined solely by the distance to the nearest hospital, but rather the ability to access reliable internet. In 2026, reliable broadband and IT infrastructure have become essential components of healthcare, forming the backbone of telehealth, medical cybersecurity, and day-to-day operations. However, Alabama specifically suffers from a twofold issue: an increasing lack of access to both reliable broadband internet and reliable healthcare services, resulting in rural deserts of care. This article explores the intersection between rural healthcare and IT challenges in Alabama, and what Prestige Technology is doing to help healthcare providers build secure, dependable connectivity. Alabama's rural healthcare challenges. As a mostly rural state, Alabama has had a history of difficulties with healthcare access, with many hospitals at risk of closing their doors entirely. There are several overlapping reasons as to why. Being a primarily rural state, hospitals in isolated areas are often the only healthcare providers for miles. For rural residents, the nearest hospital could be hours away, and patients often travel long distances for specialty appointments, increasing costs and delaying their treatment. Primary care, behavioral health, specialty care, and obstetrics remain difficult to access throughout many rural counties, resulting in healthcare dead zones. There are approximately 62 counties in Alabama that are classified as a primary care dead zone, with 57 localized centers falling into this category. Financial pressures are another factor pushing rural hospitals to the brink. Many hospitals continue operating on extremely thin margins, with an estimated 88% of rural hospitals in Alabama currently operating at a financial loss. According to the Alabama Hospital Association, or ALAHA, low reimbursement rates from Medicare and Medicaid, high uninsured rates, and recent federal spending shifts are primary drivers of this crisis. 23 to 25 rural hospitals, representing nearly half of all rural facilities remaining in the state, are at immediate risk of closing within the next few years. As healthcare systems consolidate, technology becomes increasingly important for maintaining access to care in underserved communities. However, digital infrastructure for rural hospitals is often left outdated and below national standards, especially in Alabama. Without support, rural hospitals often cannot afford to invest in technology modernization that would help improve accessible options for rural residents like telehealth, patient cybersecurity, and more. The double dead zones of Alabama. While provider shortages, financial issues, and aging infrastructure remain one of Alabama's greatest healthcare challenges, another obstacle contributing to this crisis is broadband access. Many of Alabama's most underserved healthcare regions also have limited broadband availability, creating an overlapping double dead zone between primary care and internet access. Comprehensive public health data tracking from KFF Health News and rural healthcare coalitions confirmed that 19 rural Alabama counties, predominantly in the Black Belt, are classified as these dual deserts. What exactly qualifies an area as a broadband dead zone comes down to the region's ease of access to baseline digital infrastructure. Currently, the Federal Communications Commission, or FCC, established a basic threshold of 100 megabits per second for downloads and 20 megabits per second for uploads to replace the previous 25/3 megabits per second benchmark, which had been the national definition of broadband since 2015. The newly categorized definitions are as follows. Minimum service threshold. Any area that lacks access to the national standard internet speed of 100 megabits per second download and 20 megabits per second upload, 100/20 megabits per second. Underserved status. An area that has access to the legacy broadband definition of 25 megabits per second download and 3 megabits per second upload speeds, but falls below the 100/20 megabits per second standard. Unserved status. An area lacking even the 25 megabits per second download and 3 megabits per second upload legacy broadband definition. Most research initiatives classify counties as internet dead zones if less than 70% of households have access to fast, reliable broadband. Currently in Alabama, there are 310,874 addresses, roughly 18.8% of the state, that are considered underserved or unserved. Out of those, 210,302 addresses, 12.7% of the state, live in absolute internet dead zones. This affects patients, providers, and healthcare organizations alike. Modern healthcare increasingly depends on stable, high-speed internet connections, rather than simply physical proximity to providers. Without dependable IT infrastructure, even the best healthcare technologies cannot reach the communities that need them most. Prestige Technology Solutions for Alabama Dead Zones. Alabama has seen significant steps taken on the legislative side to counteract both sides of this double dead zone crisis. Legislation and state funding initiatives targeted on helping reshape the rural healthcare landscape have been kickstarted across multiple counties. With $31.4 million allocated to IT and digital infrastructure, Alabama continues working to close both its healthcare and broadband access gaps. However, understanding precisely what service providers can do for Alabama is critical. Rural healthcare organizations in these double dead zones require up-to-date digital infrastructure for healthcare, such as electronic health records, telemedicine platforms, and remote patient monitoring. Reliable broadband access that minimizes downtime. Scalable implementation that can bring disadvantaged hospitals back to standard. Meeting these needs requires an IT partner that understands the needs of rural healthcare and IT management in Alabama. Fortunately, Prestige Technology is primed as a perfect partner for this situation. Located in Baldwin County and specializing in serving IT-challenged healthcare, Prestige views modern digital infrastructure as a strategy for preserving rural healthcare itself. Through the Save My Hospital initiative, we advocate for rural hospitals facing financial distress while promoting affordable access to technologies such as telemedicine, secure electronic health records, cybersecurity, and scalable cloud infrastructure. And with our active partnership in the USDA Broadband Expansion Initiative, Prestige leverages our expertise, along with our heart for rural healthcare facilities and Alabama as a whole, to help disadvantaged regions access the broadband that they need most. Prestige Technology offers solutions to the double dead zone crisis by providing reliable broadband connectivity that supports always-on access to EHRs, cloud platforms, and mission-critical healthcare applications. Redundant network infrastructure designed to minimize downtime and keep hospitals connected during outages. Scalable technology planning that prepares rural hospitals for emerging healthcare technologies, including AI-assisted diagnostics, expanded telemedicine services, and future digital healthcare initiatives. Our initiative recognizes that technology alone cannot solve Alabama's rural healthcare crisis, but reliable broadband and enterprise-grade IT can help hospitals expand access to specialists, improve operational efficiency, strengthen financial sustainability, and better serve patients who would otherwise face significant barriers to care. Conclusion: Alabama's rural healthcare challenges cannot be solved by hospitals alone. Closing Alabama's healthcare IT deserts and double dead zones means connecting providers, patients, and technology through dependable digital networks. As the landscape of healthcare and technology grows continually more intertwined, rural healthcare modernization depends on broadband investment and reliable IT partners dedicated to improving conditions. Prestige Technology aims to help rural hospitals build the technological foundation necessary to keep care local, secure, and accessible for the communities that depend on them by combining broadband connectivity, managed IT, cybersecurity, compliance, and healthcare-specific infrastructure into a unified platform.